99.9 KTDY, the best variety of the 80s, 90s, and today. And Stevie at 8:12. Oh, it's Wednesday. The doc is in. Dr. Kevin with Bryant Wellness Institutes of Acadiana. Good morning.
Good morning. Excited to be here today. How are y'all this morning?
My back hurts. What's wrong with me?
Oh, there's no telling.
There's not enough time to list everything.
That's it. JC
I'm not a magician.
JC says all the time, oh, Dr. Kevin helped me. Went to see Dr. Kevin today. Dr. Kevin helped me. When I ask him to help me, I get some sort of little silly remark like that. Anyway, what's going on, Doc?
Well, the last few weeks we've been discussing the importance of dealing with chronic pain early. And dealing with it in a smart way rather than just covering it up. And one of the things we had talked about over the last few weeks, and today we're going to finish up our series on chronic pain, we had said that pain is a warning signal that damage is being done to tissue, period. So anytime an area is painful, that means something is being damaged somewhere. That's what pain is for. So masking it or hoping it will go away is not a good plan to resolve it.
Yeah.
And, it's the famous words, well, it'll go away, maybe it'll go away. Problems ignored only have a tendency to get worse, not go away on their own. Even if they do go away, they're coming back usually.
Yeah, and if you're just masking the pain, it's going to continue to get worse.
Right. And so...
It's like a toothache. If you got a tooth that's aching, something is wrong, and it's only going to get worse.
Exactly. Yeah. And so why wait till your tooth falls out?
Right.
Yeah.
Instead of getting it looked at. And so our program for pain is really unlike, for chronic pain, it's really unlike any other program that's available in Acadiana. What we've done is we've taken the 4 most effective drug-free treatments for chronic pain, and we've put them together in one comprehensive treatment protocol, and that's what makes this so different. Because, the thing is, we don't have to find a single magic bullet that's going to help you. If we do 4 different drug-free treatments and each one of them helps 20%, we've just reduced your pain by 80% because each thing we did helped just a little bit. Mm-hmm. And so people will try one thing, it doesn't help them, and they give up. So, or they try something else. So why don't we try several things at one time in one comprehensive common sense treatment protocol, and if each one of them helps you a little bit, we've just reduced your pain by 80%, and that's a big, big deal. Because the thing is, if you ask most chronic pain sufferers, and by the way, if you've had pain for more than 3 months, even if it comes and goes, but the same pain, you're a chronic pain sufferer. So I don't think that's, my pain is just normal pain. That's somebody else he's talking about. But if you ask chronic pain sufferers if they would consider their treatment a success, if we could reduce their pain by 50%, they say, no, I would consider that a miracle. If you could get rid of 50% of my pain, that would change my life. And so, it's a big, big deal. If you could get rid of 70, 80% of somebody's chronic pain, you can change their life. I mean, they could enjoy time with their kids or grandkids. They can enjoy their hobbies. They could live their life again without, suffering day after day. And that's important because chronic pain patients have a tendency to do something we call behavior adaptation. What that means is they adapt their behavior around their symptoms.
Totally.
Yeah.
I do that myself.
Well, I used to plant a garden, but I can't do that anymore.
Yeah.
I used to love going dancing, but I can't dance anymore.
I don't bend down now.
Yeah, and I do good.
I wish I had somebody to tie my shoes.
Yeah, I hear that a lot too. I do good to get through the workday, and I'm just not able to do much more than just get to work and get home. Pretty soon, they've adapted out of everything that makes life enjoyable for them.
Yes.
They're literally just existing, not living.
Yep.
That's true.
And guys, life is too short for that, especially when natural solutions exist that, may make a dramatic difference in reducing your symptoms. Now, I want people to stop just for a second and think about their health. Think about how many days a week they feel some sort of a problem, some sort of a health symptom, some sort of a pain somewhere in their body. And I want you to think of your health journey as a pathway, as a road. And that road has a fork in it. One fork has you later on in life being healthy, functional, doing your hobbies, playing with the grandkids, golfing, gardening. The other fork in the road has you walkers, canes, wheelchairs, nursing facility, bedridden, home-ridden. But,
burden on your children.
Exactly, burden on your family. Now, the decision about where you end up, the fork happens now. It doesn't happen then. It's too late once you get down the road.
Yeah.
The fork in the road, the decision time is right now on how you're going to be, how functional and how healthy you're going to be 10 years from now, 15 years from now. Deciding which road you take, which fork in the road you end up down is right now. Listening to this program, this is the fork. Which one are you going to decide? So decide to do something different, try something new, and to get a better result. So the workshop is going to be tomorrow night at 6:30, where I'm going to showcase 4 new technologies that might just make the road to your health journey a much, much better one. So you can call now and register. It's 837-7174 in Lafayette, or in New Iberia, it's 367-2567, or you can join us on Facebook at the Bryant Wellness Institutes. Now, when we get back from break, I'm going to talk to you about the secret, the overlying secret to treating chronic pain.
Can't wait.